Science is the expansion of knowledge. And so if we're unable to study the world around us properly, we cannot design experiments that will ever work. This was a sexually transmitted disease. We had to collect those secretions to understand every little detail of how this happens. Now, all these 20 years later, we're still studying this. This is the key to dealing with the pandemic of the 21st century, HIV. Before I ever came to Chapel Hill, I was working at Yale. My wife is a China expert, Dr. Gail Henderson, and so she and I had the opportunity to represent Yale for a year in China, working in Wuhan, China. There, I worked as an infectious disease specialist, trying to develop exchanges on behalf of Yale. And no Americans had been there for many, many years, because we were there right after China opened to the West. By living in China, I learned how to work in a resource-constrained country under very different cultural conditions, and that experience became unbelievably critical to everything else that happened to me. I came from China to Chapel Hill. Well, that's a pretty big transition. But when I got here, HIV became an epidemic in Chapel Hill. Now, why? Well, how could it be an epidemic in Chapel Hill, you might ask? The care of people with hemophilia was a huge part of the work of the University of North Carolina. Now, sadly, obviously, as the HIV penetrated the blood supply nationwide, hemophiliac patients, unfortunately, received contaminated transfusions. Many of them died. But for infectious disease specialists, we all had to take care of HIV-infected and ultimately AIDS patients. Antiretroviral drugs are life-saving. The first drug, AZT, was developed here in North Carolina in 1987. People who start those drugs early and take them faithfully turn a fatal disease into a chronic disease with a normal lifespan. It's an amazing public health and medical breakthrough. And for every 1% increase in HIV treatment, ART, antiviral therapy, there was almost a 2% fall in new cases of HIV. And this is believed to be related to specifically treatment stops transmission. HPTN 052 is an ongoing study, actually, a study that was designed to examine a hypothesis. And the hypothesis was that when we treat someone who is HIV infected, we can reduce the probability that they will infect someone else. And so the study is a multinational study conducted at 13 sites in 9 countries around the world. We had a site in the United States in Boston, and then we had a site in Thailand, Chiang Mai, 2 sites in South America. In India, we had 2 sites. And in sub-Saharan Africa, that is the epicenter of the epidemic, and we oversampled, enrolled more couples than anywhere else in sub-Saharan Africa. And they were distributed in South Africa, in Malawi, and Zimbabwe, and Kisumu, Kenya. And so we started in 2000 and enrolled the couples in 2005 and fully enrolled in 2009. For the study I did, could not have been possible without the generosity of 6 pharmaceutical companies. These 6 companies were tremendously generous. At one point, GSK, which was kind of our anchor tenant, Glaxo, we were using about 60 or 70% of the entire world supply of philanthropic drug. So they had made a huge commitment to this study. But over all those years, we had no results. There's a safety board that oversees the work, and they have the results. So we knew nothing. April 28th of 2011, that was our 10th meeting with the safety board. Now, that's a long time. The safety board's made up of statisticians and physicians and epidemiologists and ethicists. And we had no publications related to this, no abstracts, no papers, nothing for 10 years of work, and literally dozens of millions of dollars spent. So you can imagine this wasn't entirely popular, right? Because there are no results. So they said, we have a recommendation. And I said, great, what's the recommendation? And they said, we can't tell you the recommendation. I said, what does that mean? They said, well, we'll tell the sponsor, in this case the National Institute of Health, the recommendation. And we thought we had failed. I got a call from the NIH, asked me to come to the NIH. And there I went to the NIH, and they had their whole report of all the years of work we had done. The person in charge actually stood up and said, it's a home run, and he threw the thing up in the air. And then we learned the result, that we had prevented HIV transmission, and also that we had improved the health of the subjects who had started earlier on treatment. We all worked together as a team, obviously to me very moving after all these years, to tell the investigators who actually did the work, here's what happened. And then we had this press conference at the NIH, and I didn't really know that this would be big news. And pandemonium broke loose because this was believed to be a tool that would galvanize us towards the end of the AIDS epidemic. If you're a researcher, a biomedical researcher in the health sciences, there's really only two possible goals. One is that you will have discoveries that will influence medical care, or you will have discoveries that will be put into public health policy. For me, the work that we've described today, they unequivocally did both things.